Hey guys, it's Dr. Marvin again. Welcome back. You might have subscribed to this channel to get a couple of different tips and tricks for better mental health. I did say I was only going to do 6 series, but I'm actually going to do 52. So I'm going to try and do one every week for the next year, which is sort of a lofty idea, but I'm going to try and do it because I think this can really help a lot of people, and it'll be a different topic each time. So I'm going to have to come up with 52 ideas, which I think I can do. I'm sort of wordy. So each will be under 10 minutes. It's super easy. It's not going to take a lot of time for you. So the first series was on better sleep health, and today's is going to be on stress management, which is something that people are constantly asking me about, some tips and tricks on this one. So I guess in order to kind of give you an idea of what some tips are for this, it's good to go back and look at why we have stress to begin with. It's not such a bad thing. Historically, we are supposed to go into fight or flight for, about 3 minutes or so. So we can fight something or we can flight it. We can run away. So you want all that blood going to your core organs like your heart, your lungs. You want blood going into your legs so you can take off and go running if you need to, or, attack somebody. We don't need it going to some non-essential functioning areas like our GI tract. We don't really need it in our hands. So a lot of people that have panic attacks or anxiety will oftentimes feel like a little tingling in their fingers. We also don't need it in our reproductive systems. That's kind of a non-essential functioning area. So when we're in that fight or flight, we should not have extra blood going to extra places. So those things slow down or shut down. So this is great if you're being attacked by something, right? Or if something's coming at you on the freeway. So a car's coming at you. You need to be in quick fight or flight mode, not be thinking about a sandwich, not be digesting anything, not sexually aroused. There should be a lot of places that are not getting blood. The problem is that your brain doesn't know the difference between what's really happening in front of you, like an accident or something chasing you or someone breaking into your house. Your brain doesn't know the difference between that or what you're simply thinking about, so it treats it the same way. So for a lot of people, they'll actually have really bad GI problems. They'll have reproductive issues, sexual issues, sometimes, different weird things like hives and unexplainable things, headaches. There's a lot of ways that our body manifests that stress that's in our head. So cortisol is released throughout the system, which is what shuts down some of these non-essential functioning places, or it slows it down. It just depends on your body. So cortisol is needed, but it's not needed when we're thinking about these things, just simply thinking about stress. So it does serve a purpose. It's just not supposed to be there for a long period of time, which we do. We operate in that system all the time, all day long. So one thing I like to kind of have people do is the lemon experiment. So everybody's had a lemon. So I like to have people imagine you have a lemon. So you have a nice big yellow lemon and you cut that lemon in half, you cut it into quarters, and then you stick it in your mouth. So you're just imagining doing this. So the more detailed that you think about this, you might get a little bit of salivation happening in your mouth, you might drool a little bit or kind of pucker your cheeks. So if you're not actually eating a lemon, I say that's kind of interesting that just your hormones, when you're thinking about eating a lemon, produce that response in your mouth. That's huge. So if you're constantly stressed out, wouldn't something be happening in your system with cortisol? So keep that in mind, that when we're thinking about stressful things, that cortisol is being released and it's going into, a couple of different places that might cause some long-term damage. So now that I've scared you, we want to get you back into the here and the now. We don't want you thinking about the future, about things that could happen if they happen, and we don't want you thinking about the past. The coulda, shoulda, wouldas. There's an old saying that we should on ourselves. You have to say that very, very carefully. So we don't want to be in the past or the future. Those aren't great places to be because we can't change them either way. We can certainly do some work, to make things a little bit better, but we can't change them. So how do we get into the here and the now? Well, if you have children, playing with your kids is a really effective way of doing that. If you have animals, you can do that. These two beings don't ever think about the future. They just want your undivided attention. So you build things, you're playing with them, you might make a project with them, and most of the time you're just in the moment, and it's a really beautiful place to be. So if you don't have kids, you can do projects, you can get baking going, you can cook stuff, you can do things. And even though these are only for a few minutes, it's better to bring yourself down from that cortisol release and come down to a normal level every once in a while. So it doesn't have to be for 3 days straight that you're doing these things, just for a few minutes, even if it's 10. So another technique is called the 4-7-8 breathing technique, and you might have heard it be labeled 3-5-8 or some sort of variation. So essentially you're breathing in for a 4-second count, you're holding your breath for 7 seconds, and then you're going to breathe out for 8 seconds. And the idea is that you do this about 10 times, and that takes about 3 minutes. Nobody knows you're doing it. You don't have to close your eyes, but you do kind of have to know what round you're on. So it's super easy. I've had people say they do it when they're driving, they're sitting at a stoplight. People can use the restroom at work and go and do this for 3 minutes or half the time if need be. But I've had people having severe anxiety actually be able to pull themselves out of having another anxiety attack or it getting worse by doing this. So how awesome is that? So you can do that, and it's basically a mindfulness activity because you can't think about stressful things while you're thinking about how many times you've taken a breath in and how many times you need to count to hold it. So it puts you in the here and the now. And you also send oxygen to your brain, which helps your brain to say, okay, I think that stressor is over. Because when we're stressed, we also have really bizarre breathing patterns where it's kind of choppy, right? It's like something like that. It's not, it's not smooth breathing. So it's another sign to your brain that something drastic is happening. Even when you're just sitting in class thinking about something stressful, or you're at home worried about how you're going to pay your bills or what your kids are going to do in 10 years from now, you're breathing funny is most likely what's going on. So those are some techniques. There's also one called the 5 senses that I like to do with people. So you have 5 senses and you find 5 things for each of the 5 senses that are around you at that moment. So 5 things you can see, you think of 5 things you can smell, you think of 5 things you can hear, 5 things that you can taste, and 5 things you can touch. And if you get confused on the senses, which I sometimes do, I just go from head down. So you do your eyes, your nose, your ears, your mouth, and then tactily what you can touch. So it's easy to find 5 things you can see. It's actually really difficult to find 5 things that you hear and 5 things you taste. So I've had people even try tasting the clock that's sitting next to them. I mean, that's kind of ridiculous, but it helps you to really become mindful of what's going on around you and not sitting in your head, which can be a kind of dangerous place to go. So that's another really neat one to do too. Of course, I'm going to plug therapy because I think that's really important, but it can be anybody that you talk to, someone that you trust. Could be a pastor, could be a mentor, a family member, could be a friend, a therapist, whoever. As long as when you're telling them what's going on with you, that they're not trying to change you immediately in a bad way, or they're also not trying to tell you their problems, because now you've got 2 sets of problems, right? You're trying to get some help for your own, and then they're telling you what's going on with them. Not a good place to be. So there's some some tips and tricks for you. Got a little tongue-tied, and hopefully all those help keep you mindful. And that's a good place to be so that you're not releasing that cortisol, which slows or shuts down different non-essential functioning organs like our stomach and our hormones that are associated with our reproductive systems. So, and when that happens too long, it can cause a lot of internal issues. So you want to be in that mindfulness, rest, and relaxation mode. For more information on stress management or different tips and tricks in this area, you can email me. You can find me on my Facebook page at the Whole Body Wellness Center, or you can also go onto my website, and it's all going to be listed in the link below in the comments section of this video. So stay tuned for more coming up in the next 50-something weeks, and hopefully these are helpful for you guys. All right, take care. Bye.